In this section, we're going to review the requirements for antimicrobial stewardship per CMS that are specific to the SNF. CMS requires that you record your overall antibiotic consumption for the SNF facility. It's important to break out this data based on patients that were prescribed an antibiotic by another provider at another facility, because the SNF is often the receiving place for many other facilities. It's important to call out, okay, for my SNF facility, these are the antibiotics that we prescribed. And that's an important distinction and one that you want to report when you're talking about antibiotic consumption. The person who does this data collection and analysis is your consulting pharmacist typically. So be sure to ask your consulting pharmacist about this particular aspect of the CMS requirements, and they should be able to help you. So in addition to documenting when antibiotics were prescribed and how many antibiotics were prescribed, it's important to note what antibiotics were prescribed and for what diagnosis. So that's another part of this report that your consulting pharmacist can put together for you. The calculated days of therapy it can be a little bit tricky for some folks, and it's calculated as the number of antibiotics given to a patient in a day divided by the number of days the patient is in the facility. And again, this data can be kind of complex, and so your consulting pharmacist, once again, is a source of great expertise in helping pull these numbers together for you in your facility. Another aspect of the CMS requirements is to demonstrate that you have an awareness of your antibiotic resistance data by bacteria that have been isolated in your facility. The SNF care environment can be associated with some unique resistance patterns that are unique to the facility and unique to the patients that you all are taking care of. And so to achieve an understanding of this data, the classic instrument of data reporting for this data is the facility antibiogram. Now, your consulting laboratory can produce this. Most of the SNFs that we've seen here in Nevada have a laboratory vendor that is able to email them a PDF file that has a chart. And on one side of the chart is a listing of the bacterial species, and the other side of the chart is a listing of the antibiotics. That's an antibiogram. And the antibiogram is important because it's usually based on data acquired over a 6-month period or a 12-month period and shows you what kind of drug resistance you're dealing with by bacteria. Another example of demonstrating this awareness is understanding what kind of multi-drug resistance, extreme drug resistance, or pan resistance you might have in your facility. Another aspect of this is empiric prescribing guidance that's specific to the facility. So again, your consulting pharmacist comes into play here, where they can consult the data from the antibiogram and be able to give your healthcare providers specific guidance on what antibiotics should be used initially before you obtain culture results on your patients. So all of this information demonstrates to CMS that you have an awareness of your data and you're conducting your stewardship activities with that in mind. So demonstrating historical trends and looking at where the trend will take you in the future if nothing changes is really important as well, because you want to understand where is your facility headed for long-term antibiotic management. And this is important to show the team also whether or not your antibiotic consumption rates over time are improving or getting worse or staying the same. Same thing with your resistance patterns and prescriber compliance patterns. So if you have a couple of healthcare providers that are doing really well with their antimicrobial stewardship and they're doing well in showing improvements in their antibiotic prescribing and what types of antibiotics that they're prescribing, you can demonstrate this to the team using simple graphs from Excel that you can show the team improvements in your data. And this is really important to communicate in a positive way progress that you're making. It also happens to satisfy a requirement for CMS. And so a lot of these discussion points that we're sharing with you here, these are ideas of how to accomplish these objectives, but not necessarily prescriptive. So one aspect is to look at the rates of infection by drug-resistant bacteria type. So for instance, multi-drug resistant Pseudomonas. That you're able to show your team and show CMS potentially infection rates over time from these highly resistant organisms. Perhaps the most important one to track would be C. diff, of course, because C. diff is a pretty common high threat agent that we're seeing in the SNF community. And again, you don't need to go to a complicated extent here. You can just simply plot the information on an Excel spreadsheet, and you can show the line graphs over time, and it's pretty easy to tell if you're doing better or doing worse over time. So CMS requires monthly reviews of prescribing practices, and that can be a big burden on the team. And so again, this is another place where your consulting pharmacist can really shine. You want to aim for the majority of most of your, basically we're looking at more than 90% of your prescriptions over time being considered appropriate for the clinical condition indicated. Now this is driven by your empiric prescribing guidance that's issued by your consulting pharmacist. So after reviewing the drug resistance data in your antibiograms, your consulting pharmacist should be able to put together sort of a top 5 or top 10 list of the leading diagnoses for which you prescribe antibiotics, and then share with the healthcare providers in your facility what empiric antibiotics they should be prescribing for those diseases before they get their culture results back. And you can actually monitor for compliance over time. And of course, when you communicate the results back to the team, again, you want to be very positive. You want to continually reinforce in a positive way all the progress that you're making as a team. So healthcare providers in the SNF setting, they need to understand the minimum criteria required to start antibiotic usage. So this speaks to the question of making sure that we're giving antibiotics when appropriate. And we did discuss earlier that the SBAR, it's not perfect, but it is a tool to use. It is considered a standard tool by the government. And so you might want to consider using that. And so making sure that the SBAR is filled out for patients before initiating antibiotics. Another aspect of ensuring compliance with this is using standard clinical guidelines. Standard clinical guidelines that might need to be modified depending on your drug resistance profile. So we need to keep in mind that clinical guidelines that are written by a national authority, like the Infectious Diseases Society of America, is wonderful, but it may not reflect accurately what's going on in terms of drug resistance in your facility. So you want to make sure you put those national guidelines in context with the resistance patterns that you're seeing in your facility. Again, for all of this complex analysis, your consulting pharmacist is really a tremendous resource. So don't be bashful about offering education for your healthcare providers. Yes, they are expert at what they do. Yes, they've had years and years of training to be able to be a healthcare provider, but that doesn't necessarily mean that they fully understand stewardship. Stewardship is a very new thing. It's an evolving field. It's very complex, and it requires a team-based approach. And so we don't want to assume that everybody knows everything, including people who practice stewardship every day. Me personally, I have spent quite a bit of time researching myself, and I always find that I don't know everything. And it is a humbling experience. So keep that in mind when you're talking to your healthcare providers, that this is a complex thing. And it can be kind of overwhelming for some folks, but that's okay. You just take it one little step at a time. When you're educating your providers, you definitely want to leverage the insight and expertise of your consulting pharmacist once again, that they can help explain challenging concepts like minimum inhibitory concentrations. They can review national guidelines. They can place those national guidelines in context with your local resistance data for your facility. So it's a team-based approach. And then when you're reviewing the results of your intervention here at a stewardship level, you definitely want to emphasize the positive aspects. If you do encounter a situation where something didn't work out, it's not the end of the world. You sit down with the provider and maybe review what the data shows and discuss with them possible avenues to fix the problem, or maybe redirect and try a different course of action. So again, positive energy really works in stewardship. And just keep in mind that you're working as a team and everybody has a common goal working together. Problems that occur are probably inevitable. I have certainly seen some challenges and problems in my own clinical environment as well. And really, so long as everybody stays positive, you can work through even the difficult situations together. So following the CMS requirements for stewardship requires an understanding of what stewardship is, but also leveraging the expertise that is in your team. So most SNFs typically have a nurse who is in charge of infection control. They also have another individual who handles their pharmacy interactions, is typically your consulting pharmacist. Sometimes they're an outside contractor doing that work. You may also have a medical director who's a physician that has years of experience looking at antibiotic prescribing. They may not fully understand stewardship, but they certainly understand the nuance of prescribing antibiotics for their patients that they're worried about. Having a team like that is a guarantee for success if you work together and stay positive. Lastly, once again, you want to make sure that your corporate administrative leadership is on board with this. What we found over, just from personal experience, is that so long as the medical director, the pharmacist, and the head for infection control on the nursing side are all on board together, most of the time the corporate leadership rolls alongside and supports them. So this doesn't have to be a controversy or a point of conflict. And we've seen quite positive outcomes actually in the SNF care setting already here in Nevada. So we wish you the very best of luck in this adventure. And with those of us here at the University of Nevada, Reno, we are here to help you. So if you have any questions, please don't hesitate to contact us and we can always give you a hand.